What was nursing like in long-term care even before the pandemic had started officially in Canada? What was it
Yeah.
like then?
Yeah. So it seems that the whole COVID thing has been a springboard to highlight the inequities and the understaffing and so on in long-term care. That has existed for a long, long time, and lobby groups such as the Long-Term Care Association and ONUS have constantly and consistently been lobbying the ministry for more staffing, for better resources, and so on. So this is not a new problem. I think that things are worse since COVID, but before then, I would say homes were kind of managing with resources such as PSW students, RN/RPN students, a whole host of volunteers, family members coming in, visitors coming in. So long-term care typically has been understaffed, but people managed and staff worked very, very hard in long-term care. So often going
Hmm.
above and beyond, trying to make people comfortable. I guess the other thing that's changed over the last number of years is long-term care has become the ground of placement for everybody and anybody. So not just frail elderly with dementia, now people with different disease comorbidities, Huntington's, Lou Gehrig's disease, Parkinson's disease, young people with motor vehicle accidents and acquired brain injuries. So long-term care
Oh,
staff
wow.
in the last quite a few years has been
Hmm.
expected to look after complex care patients. And that just adds a whole other layer with the same staffing. So a pretty hard expectation for staff in long-term care to be able to manage those complex individuals.
Right.
So,
And I remember when Doug Ford was elected as the Premier of Ontario the first time. I believe there was sort of a commitment on the part of his new government that he was going to get involved and start dedicating more money towards long-term care. But we'll get to the Ontario government's piece of what transpired as soon as the pandemic hit and his involvement or the decisions that his government made. But you raised an interesting point. You had talked about students, PSW students, nursing students, family members. So really, those nursing students and PSWs, are they like co-op positions? Are they volunteer positions? What makes up those particular groups?
sure. So students that come from the community colleges or from university settings, they would be placements. So they're not paid positions, they're placements for a period of time.
Hmm.
And that's really the training ground where people get hands-on experience, learn under trained nursing staff or trained PSWs who are very good at their jobs, and they actually learn from them. So
Right.
excellent in terms of learning and then also lending a pair of hands when they learn to do some things, feeding, transferring, toileting, all those things, learn them very
Hmm.
quickly and then become another pair of hands in long-term care
Hmm.
to help the nursing staff. Visitors and volunteers, often homes have a high complement of volunteers. So some of them 250 volunteers who come in and do various functions. So you may have volunteers who specifically come and help feed at meal times. So often these residents are incapable of feeding themselves. Often, if they are, they take a very long time to feed. Often they're on different diets, such as puree diets. So the swallowing becomes difficult. So volunteers are a huge asset in long-term care in terms of feeding. Then there are volunteers that help order people to activities. They actually help for some of the programming that goes on. They may help for just companionship for people, helping to orientate them. So lots of different functions that volunteers have. And then, of course, family members. Many homes have an essential caregiver or a family member that's there on a daily basis or a few times a week that comes in just to help with whatever's needed, to provide companionship, to provide some kind of emotional stimulation and stability and so on. So all of these people are in addition to the core staffing that each home has and much, much needed and greatly appreciated in long-term care.
So what would you estimate or guesstimate is sort of the percentage of full-time paid staff compared to the percentage of maybe volunteer staff?
Okay, well, each home would be very different, but if you take a home's entire staffing, so kitchen staff, housekeeping staff, maintenance staff, PSWs, nursing staff, I would say the volunteers maybe are a quarter, maybe even greater. If you add family members into that, probably, I don't know, maybe approaching a third. As I say, every
Okay.
home is different, and I just don't have a good handle on how many. Um, I think in terms of hours of work and hours of
Hmm.
assistance, it would be many, many hours that they are providing just on a volunteer basis to each home.
Okay. And there's a specific reason why I'm asking this question, and I'm just hoping the viewers will be patient and they'll understand why this has become a very, very important question in terms of understanding the ratios or understanding who's in the long-term care helping the patients. I want to ask you something before I go on and kind of get to the point that I'm trying to make. Prior to COVID, what would the procedures be for if there was an influenza or a sickness or something? What would the instructions to the families be if they were sick and thinking about going and visiting or volunteering family members? So what are the procedures really I'm trying to get at for anybody who believes that they have an illness going into long-term care?
So generally, people would be told not to come in if they have a communicable virus or some kind of an illness. Please stay away. Phone in and ask how your family member is doing, and we will certainly tell you everything you want to know. So, of course, not encouraged to come in at all during that period.
Mhm.
Having said that, if somebody had a parent or a relative who was dying and who
Yes.
absolutely needed to come in, they would probably be coached and counseled how to safely come in. Maybe asked to wear a mask, although I didn't see that very often.
Mhm.
But generally, nobody was swabbed, nobody was tested, nobody was ever questioned on the safety depending on what illness they might be harboring. So
Mhm.
generally, no came and went without any questioning. And we have always considered long-term care the resident's home. So in your private home, you may have come in who you want to come in at whatever time you want them to come in and how many people you want to come in. So that was always
Mhm.
typically the thinking for long-term care. It is the resident's home, and they make the decisions around who they want to have come visit.
It's very interesting because in when I was campaigning last year and, I go to different events and I always meet people that had family members in long-term care. And now I'm kind of switching to post COVID. So after the first lockdowns and a complete departure of
Absolutely.
everything that we did prior to COVID. And
Absolutely.
I've met a lot of people who were very frustrated because they weren't in a position that they could pull their family member out of long-term care and bring them into their home. But long-term care management got in line with government dictates, and it had a profound impact on the residents themselves. So I'm not going to talk too much about it because you and I did have some, conversations about this in the past on the phone. And you're in a better position to speak to this more accurately than I am. So if you could you maybe describe post COVID after, during the first lockdown and I guess to present day, what it is that you're seeing?
Yeah. So during the first lockdown, decisions were made that I have never ever seen before. Prior to that, for many years, if homes had an outbreak of influenza or whatever, E. coli or some kind of a gastric bug, that
Hmm.
area would be closed up. In other words, the staff would be dedicated to that area, and people were told not to visit until we're over that. And rotatingly, you would see the 36 homes in my Lynn area take turns, maybe 10 at one time, would have some kind of a bug. Within 2 weeks or so, things would be cleared up and everything's back open again. So none
Hmm.
of this, we're locking everything down. None of this, we're not letting anybody come in and see you. And, you deal with it. It's over. You move on. So
Hmm.
at the time when the ministry decided to shut everything down.
Can I ask one question though? Can I ask one
Yeah,
question
of course. Of
about
course.
that? When you prior to COVID, when you would shut down an area, would you allow access to of the volunteers into those areas or not?
Yeah, they would be very much discouraged from coming in, and typically you would not have any staff coming and going. But it was for such a limited period of time that
Hmm.
it really didn't make that much of a difference. You wanted to contain,
Okay.
whatever the viral outbreak was, deal with it, and then move on. So
Okay.
no,
All right.
typically people wouldn't be coming in. And as a
Okay.
as a consultant, if that was one of my home areas, I would just have to reschedule my visit to when it was over. But typically in 2 weeks it was finished. So at the onset of all of the COVID regulations, the ministry decided that everything would be shut down. And that impacted my job too, because I could no longer go into any of the homes, which was fine. I said, redeploy me somewhere, which they did twice. But basically, what they did was they took away all of the support staff that were not health professionals. So now a home that's used to having visitors, volunteers, family members, students, all those people were not able to go in. So if you think about that, that is taking an enormous amount of hours of care away from that institution or that long-term care home and left with nothing, right? There was nothing to replace it with.
Hmm.
In addition to that, all of the long-term care homes were told in their outbreak areas that they were no longer able to provide congregate dining. So basically in long-term care, I don't know if you've been in a long-term care home, Tom, but most of them really mimic sort of a social setting where you have
Hmm.
a large number of people. It could be 20, 30, 40, 50, depending on the size of the home and the size of the dining room. They have a congregate dining setting where you have residents sitting together, usually four at a table, and then you usually have one or two PSWs or a visitor or a volunteer or a family member that's assisting these people to eat. That was taken
Hmm.
away, and now all of a sudden, tray service was introduced. So one PSW going to one resident and feeding one person at a time, and usually in bed or in their room if they were isolated. So you can
Hmm.
only imagine the amount of time that that would take the staff to actually be able to accomplish feeding and hydrating residents who
Hmm.
normally take a long time, 3 meals a day and two or three snacks a day. That becomes an impossible task. There aren't enough hours, even though what I had observed when I was redeployed, that staff were working as hard as they could, not the fault of the staff at all. They were
Hmm.
trying what they felt so badly that they were torn in so many directions. But that is an impossible job. You cannot expect that staff would be able to accomplish that, let alone the myriad of other things that staff are required to do in a day for a single person. So that
Hmm.
alone is a horrendous, devastating, I guess, implementation of the Ministry of Health in long-term care. And in my opinion, that caused more deaths in terms of dehydration and delirium that any
Hmm.
COVID outbreak would ever have in a home. You can't take that many people away. So, and expect that you can have a home that functions.